one will get done with the opening formalities. And I would like to talk a little bit about what brings us here for the next 2 days. We convoke this workshop for us to rub minds and share ideas on the challenges of maternal, newborn, and child health, not necessarily from the traditional angles that has been approached. Our area of competence and focus is mainly about fiscal governance and public finance management. We are trying to review how government budgets and government's fiscal policies impact on the rights of women and children and the newborn. Because when these figures are being thrown at Nigerians, every minute, every hour, you talk about the number of days or number of people who are suffering, it's like Nigerians look at them as expendable people. Nigerians look at them as expendable people. Expendable in the sense that nobody actually connects what is happening to what I consider to be the most fundamental of the fundamental rights. And that most fundamental of the fundamental rights is the right to life, is the fulcrum upon which other rights revolve. If you are not alive, you can't be talking about your right to fair hearing, you can't be talking about freedom of the media, you can't be talking about the dignity of the human person. It is the most fundamental. And the discussion is how can we enforce these fundamental rights using government's policies and government's priorities as reflected in the budget. And so the whole idea is for us to take it a little bit on a new notch. Let's not just talk about it quietly. Let's talk about it, mainstream it in everyday discourse, in the media, print and electronic. Let's have issues. Let the people in the social media, on Facebook and Twitter, begin to talk about these things more actively. So that at the end of the day, government will be forced to take concrete actions and decisions that help to reduce the high rate of mortality and morbidity. We've had the MDGs 4 and 5. We started this race 1999-2000, and everybody thought the time was long. And today we're in 2005, not much has changed. We have not met the targets. So what do we need to do extra? I think that's the whole point of brainstorming over these next 2 days. What are those critical things we need to do extra so that our government can begin to take this more seriously and Nigerians can begin to take it also more seriously? So ladies and gentlemen, on behalf of Center for Social Justice and our partners in CSJ, I say a very big welcome to you. And wish that over the next 2 days, we'll have fruitful discussions. But it's important for us to know each other, although we sent invitations and other people who are in this room who you haven't met. So it's important that everybody introduces himself so that we can relate in a much more informal manner. Starting from myself, my name is Onyebere. I am the lead director of the Center for Social Justice.
Good morning, ladies and gentlemen. My name is Aziz Nadewale. I work for IC Report.
My name is Karim Rafi from Center for Human Rights and Conflict Resolution, based in local Abuja.
Good morning, Muhammad Ino Shuaib from Community Health and Research Initiative of CSJ.
Good morning, I'm Ugochi Ekweme, Media and Communications Officer for Public and Private Development Center.
Good morning, I'm Clement Okeke. I work with AF, Association for Reproductive and Family Health. Thank you.
Good morning. My name is Atiku Samuel. I'm the lead researcher. Okay, sorry. Good morning. My name is Atiku Samuel Oluwatobi. I'm from Budget. I'm the lead researcher.
Good morning. I am Wilson Imogan. I work with Women's Health and National Research Center based in Benin.
I am Nancy Oko Onya. I work for Neighborhood Initiative for Women Advancement in Ebonyi State.
Good morning. Evelyn Shoma, I work with Gender Care Initiative.
Good morning, my name is Kulia. I work for Safe Mama and Child.
Good morning, my name is Maureen and I work with Center for Research, Advocacy, Women and Youth. Good morning, I'm Patricia Medupe. I represent the Pediatric Association of Nigeria.
Good morning all. My name is Kiru Mwabweze. I'm the chairperson, International Federation of Women Lawyers. Thank you so much.
We are not hearing you, madam.
Roslyn Henry, Water Consumer Fund.
I'm Susan Akila. I work with Save the Children.
I'm Atobon Gregory. I work with Catholic Caritas Foundation of Nigeria, Abuja.
Good morning, all. I'm Mario Deli Adeson, Media Officer at DevComs Network and Web Administrator, Nottingham Campaign.
Victor Lema is my name, from Responsible Citizenship and Human Development Initiative, GoPay. My immediate neighbor that just left is coming, Abbas from Youth for Peace and Development Coaching.
My name is Bola Kolapo from DevCom Network.
Good morning. My name is
Close the door.
Grassroots Health Concern.
Good morning, my name is Emmanuel. I work with Women Advocates, Research and Documentation for
Emeka Mkene is my name. I'm a development consultant.
I have the mic. Well, ladies and gentlemen, I've been informed by the officers who are doing live streaming that anybody who wants to talk should raise up his voice a bit because this is being streamed live. And the low tone also stretches the ears of those who want to listen to the program. Now, if you look at the agenda for today, we have tried to put this in some form of sequence to discuss some basic introductions and fundamental issues. And then there are some government agencies we're also expecting, but we can't wait forever. We are losing time. So what we'll do is we take the presenters that are here while we await the others that are yet to come. So let us call on Mr. Ngene Chukwuemeka, who is going to take us through the 2015 federal budget and maternal, newborn and child health, because we are making a submission, we've already made one, to the committees in the National Assembly on what they should do or how they can retouch the budget as proposed by the executive. We still have the opportunity of getting back to them. So while we make this presentation, we will appreciate if there are more comments or more inputs that can still be made so that we can get back to the committee because they are yet to pass the budget. So Mr. Angele, please come and take us through this presentation.
Good morning, Lead Director, Center for Social Justice, and other members of his team. Good morning, ladies and gentlemen, and fellow participants. And for those who are watching us live from all the media, good morning. The task that Mr. Ngene has been asked to do is to discuss the 2015 budget for maternal, newborn, and child health in Nigeria. And as Ms. Deze said, we are engaging the National Assembly, and the policy brief is being discussed with them. So we think that it will be good to show the stakeholders here some highlights of that policy brief that is being discussed. The purpose of this presentation is for you to see, and if you have inputs, a way of enriching that discussion, you will have the opportunity to make your inputs. Let's see the outline of my presentation. First, I will show you the preamble, introduction to the issues. Then we will take the National Strategic Health Development Plan. We see the key issues in MNCH and the targets set for 2015. We also reviewed the MNCH in Nigeria and some other African countries. So we will show you the findings of that review. Then we'll discuss the 2015 budget as a strategy for addressing the MNCH issues. Part of the challenge that the stakeholders have is insufficient funding. So we have included sources of funding for MCH as in presently exist, and then there are other possibilities we also think could be explored. After those, we will see the conclusions and then the policy recommendations that are being discussed with the committees in the House, in the National Assembly. So the preamble. Maternal, newborn and child health issues affect estimated 80% of Nigerians. Who are these Nigerians that are affected? Pregnant women, newborn children, newborn infants, newborns, then children. Those are the people that are affected by issues. And when you put that, given the population of Nigeria, we estimate that to be about 80%. And if 80% of a population are affected by issues, then there's need to pay attention to that issue. Nigeria is a signatory to MNCH standards, such as MDGs and African Charter on Human and People's Rights, and our own homegrown transformation agenda. The MDGs 4, 5, and 6 talk about maternal health, child health, and HIV. So those 3 MDG goals are indeed what we signed into, and they are part of the MNCH issues. In Africa Charter on Human and People's Rights, there are sections there that make the right to health and the right to life also as rights that people, African people, should enjoy. And Nigeria, having signed into that charter, are then mandated to make efforts to provide the necessary measures that should be achieved. In the transformation agenda, which is the socio-economic blueprint of Nigeria's government, there's a huge discussion about those issues, and there were targets that were set, and the TA commits that efforts and resources will be made to improve the maternal, newborn, and child health situation in the country. So within the ACH, Nigeria is obliged to adopt legislative and other measures to ensure that the right to health is enjoyed by the citizens. I have underlined adopt legislative and other measures because the focus, as you now know, is the National Assembly, and they do legislative business. So most of what you would see are things that have to do with appropriation, what the National Assembly could do to help in giving effect to right to health, and they are obliged to do it. So there's no shying away. Something must be done because we've signed into the charter. But beyond that, there's a joint effort that is required of the executive, legislature, health professionals, NGOs, and parents if the MNCH situation will need to be improved. So it requires effort from every of the relevant sectors. So let's look at the MNCH issues as we were able to identify. The first comment I may make here is that when the professionals in the sector who have been invited to this meeting, when they come, they might give us additional information as to what constitutes maternal newborn child health. What we have done, what I've done here is to identify the ones mentioned in the National Strategic Health Development Plan. That's where these issues were taken from and these targets were picked. So in the event that they come and there are additional issues, they will tell us those additional issues. But the first issue there is life expectancy at birth. And the target for Nigerians is that by 2015, the expectancy at birth should be 70 years. Meaning that barring accidents, a child born, in 2015 is expected to have 70 years of life if there's no accident. So if there are sicknesses, diseases, environment, other issues, the person can be expected to live up to 70 years. The second issue is under 5 mortality rate. That is children between ages 0 to 5, the rate at which they die, or on the other way, the rate at which they survive. So the target is that live births, if you have children, 1,000 are born, we expected that only 75 will die before they get to age 5. That is death from different causes. For infant mortality rate, infants talk about children in the first few months of life. So these infants, out of 1,000 that were born alive, live births, only 30 are expected to die. That is as at 2015, by 2015. The fourth one is proportion of 1-year-old immunized against measles, and that is expected at 25. So all the children born and within the first 1 year, 95% of them are expected, according to the national target, to have been immunized against measles. The fifth one, prevalence of children under 5 years of age who are underweight, those who are not weighing as ordinarily they should weigh, underweight children, 17.90%. That's how low it is expected to be in 2015. Percentage of children under 5 sleeping under mosquito nets, 60% of children under 5 are expected to be sleeping under insecticide-treated nets. Now, maternal mortality ratio, that is the percentage of women who in the course of giving birth they die. Out of 100,000 women who give birth to children, live birth, that is not stillbirth, the children don't die at birth, the children survive, then 136 of the mothers only out of 100,000 are expected to possibly not survive. That's by 2015, and we are in 2015. Adolescent birth rate is supposed to be as low as 90 out of every 1,000 births. Number 9, HIV prevalence among population aged 15 to 24 years. In other words, HIV youth prevalence rate is supposed to be 1%. These are targets. There were, if you remember, the transformation agenda was designed to operate from 2011 to 2015. So if you go to the TA, you are going to see targets for 2013, 2015. I'm not bothered to put those because I don't want to give too much statistics, but we will go down in the next slide and see how the actual has been against those targets. The question I ask is whether Nigeria can achieve the targets. And I have said no. Why did I say no? There are two examples. Life expectancy at birth was targeted to be 63 years in 2014 and 70 years in 2015. I hope you still remember this figure. But as at 2014, it was only 52.62 years. So first, we have not met this 63 years target for 2014, and if it was only 52.62 years in 2014, then there's no magic wand that I have seen that will make us jump from this in 2014 to this in 2015. Does anybody think you have seen such a magic wand that can make us achieve that? That's an engagement question. Yes.
Though it looks unachievable, but if we have all we need to have in place, the finance, the political will, and then the personnel that is needed, the trained personnel, and then the willingness of the personnel to do the right thing, coupled with the cooperation of the population, I think we'll be able to achieve that. Because if we have everything in place and the citizenry is not willing to access what we have in place, it will not be achievable. And then if the citizenry is willing to access the services, go to the facilities, and then when they get there and the things are not there, it will still not be achievable. So what I think is that looking forward and looking at where we are, and then we work towards having everything we need in place, surely we win.
Thank you. Madam Nancy. And everyone would agree with your analysis and conclusion. But I want to say that seemingly Nigeria has, if you like, given the commitment to the transformation agenda, we can argue in the positive that they have done quite a lot. But I'm saying that there's a logic. That logic is that if we have a target for this year, and that target has not been met, even with all the efforts in the transformation agenda, and there is nothing happening again, there's no fresh commitment, nothing is, there's no impetus, there's no force that is pushing to make the change, then I don't see how we will, as a nation, transform from 52.6 years of life expectancy in 2014 to 70 years in 2015. That is my argument, and it's also perfectly in line with our analysis. So the point I make is that the targets may not be achieved. The other example I like to pick for our discussion is the issue of infant mortality rate. It was targeted to reduce from 60 out of every 1,000 live births in 2011. It's targeted to reduce to 45 out of every 1,000 live births in 2013, and then 30 out of every 1,000 live births in 2015. But as at 2014, it still stood at 74 out of every 1,000 live births. See the target for 2015, 30 out of every 1,000 live births. But as at 2014, we were at 74 out of every 1,000 live births. So, the same question comes back. Is there a magic wand, something you can just do, and there we go, that will make us move from 74 out of every 1,000 live births in 2014 to 30 out of every 1,000 live births in 2015? Given that this was the target for 2011 and then for 2013, and those were not achieved. If they were achieved, then we wouldn't be having this rate. If 2013 target was achieved, it would have come down to 45, but it was not achieved. That's why we still have as much as 74 out of every 1,000 live births in 2014. So the argument, therefore, is that the 2015 target will not be achieved. Does anybody agree with me? Yeah?
So move on.
No, I need to carry my people along. What do you think?
Well, I think government need to be realistic in their policy.
Okay. In certain targets.
In certain targets.
Okay.
When you set target that you cannot meet up with at times, it leads to tension. Even as individuals and as a nation, people are watching. The expectation will be so high based on the pronouncement by government or the proposal. So I think government needs to be realistic. Set a target that will be able to be achieved within the stipulated time. I think that will help us.
Thank you, my brother. You are the person for Kogi?
Yeah.
All right. You are welcome. You see, look at the figures in the targets. 60 in 2011, 45 in 2013, and where's the other one now? 30. And 30 in 2015. So you just notice that there is the same thing. Then the difference between 60 and 45 is 15, and the difference between 45 and 30 is 15. So they are just, using towards the back. So, like he observed, there's no reality in setting up these targets, and that is partly why. Please, you may. Give her the mic, yes.
I agree with what you're saying, but reality shows that sometimes we have some of these figures generated by unskilled health workers. Are you getting it?
Yeah.
You may shake your head this way, but I've had field experiences. I was just telling them that where I come from, a particular health center was supplied with RDTs and anti-malaria. At the end of the month, we went back for collation. Malaria treated. People who reported to the clinic with fever was 1,000. 1,000 persons. Yes, reported with fever.
Okay.
At the end of the day, the anti-malaria finished.
Okay.
The RDT was not used.
What's RDT?
Rapid diagnostic test for malaria. And then, summary of total persons that were treated of malaria was 2,000 plus. So how did you treat them? How did they report? When did they report? How did the figure come by? And now you see the graph. It's such a funny thing. Why am I saying this? The data we collect from some of these health facilities are fictitious.
Not professionally.
Good. And then when they are computed and brought to the center, even when they are not really looked at again, they work with it. And it is going to be very difficult for us to have tangible things to work with. Sometimes again, we have it where we kind of want to adopt another country's policy, hook, line, and sinker. And that is where we had the issue of Bamako appearing in Nigerian policy documents, some time ago. And we don't try to, make it what is in our own place. If we're adopting it, we adopt it to suit our own environment with what is on ground and what we think we can achieve. The global organizations could set targets for us, but what realistic target can we achieve, knowing what we have?
Thank you.
Yeah, sorry, sir. Setting targets, I don't think it's out of this world. It only propels you to achieve your goal. You look at the varieties of what you have to achieve your targets. Do we have it? That's where the question is. I was not actually clamped on that. We're just looking at the targets, the figures, 75 out of 1,000. What we need to look at is, okay, can we achieve it? That's what we put to test. It's not the targets. I can set the target at 20 over 1,000 next year if I have a variety to actually make it work.
I think, thank you. By the way, these figures were sourced from targets in the National Strategy Health Development Plan. I just didn't say that. Next time, maybe I think what I would do is to leave the participatory discussions until when I finish, so that we can save. So we have said that the targets may not be achieved. But in this slide, I want to show us some of the challenges that the stakeholders in the sector or subsector of the MNCH have identified. And then I will, on the other hand, look at the notable achievements that we made in the subsector of MNCH and then make an argument. First, the challenges: inadequate budgetary allocation to MNCH. Number two, untimely release of budgeted funds. And as Nancy had earlier mentioned, migration of health professionals. Those are the three key challenges that stakeholders identified. We looked also at whether there has been any reasonable and notable achievements that we made, because sometimes our stakeholders, they do a lot, they work a lot, and they make some achievements. So it's good as well to look at what have been achieved, so that it doesn't appear as if no results are found. First of all is that the